The Healthy Development of Your Baby and Important Information for a Healthy Pregnancy by Katie Knox. This is my contents. In this presentation, we will look at how the fetus develops within the uterus up until the day of birth. We will look at different ways to monitor the fetus during pregnancy as well as during labour. We will describe different screenings pregnant women will be offered and what others are available, including some processes of screenings. We will also delve into the sensitive subject of miscarriage, including getting rid of myths and how to reduce the risk of miscarriage. Finally, we will look at medical and surgical terminations, the processes and why they could be necessary. How a healthy fetus develops within the uterus until birth. The first day of pregnancy is from the first day of the last period. In the first 3 weeks, the soon-to-be baby is called a zygote. From the 3rd week to the 10th week, it is then known as an embryo, and from 10 weeks it is known as a fetus, and will be until birth, which is normally 40 weeks. Pregnancy is typically separated into 3 stages or trimesters, the first trimester or the embryonic stage. This is where the most important organs and functions are made, including the brain, spine, heart, respiratory system, digestive system and muscles in the face. From 16 weeks, the embryo has its own heartbeat, and from week 6, the embryo has its own heartbeat and has implanted into the uterus wall. 4 membranes are created to support and help the embryo growth. They are the amnion membrane, which is a sac. It is also known as the amniotic sac, which surrounds the embryo as it grows. It also fills with amniotic fluid. The yolk sac is a membrane which contains vital nutrients for the zygote in weeks 2 and 3. The chorion membrane is an outer membrane which surrounds the amniotic sac and provides extra nutrients and protections to the embryo. It joins with the amnion membrane to make the amniotic sac, and it also produces villi, which extend outwards and connect to the woman's blood vessels. The chorion membrane also makes chorion fluid, which protects the embryo from shock and any force from movement that is made during pregnancy. The allantois is a duct which is found at the bottom of the embryo, and its main purpose is to get rid of liquid waste and transfer gases. The placenta. The placenta plays a huge part in pregnancy, especially for protecting and the development of the embryo into fetus all the way to birth. It is connected to the umbilical cord. During pregnancy, it supplies the embryo with oxygen and nutrients while getting rid of waste products. It provides hormones for development and finally provides antibodies to protect against any illnesses. The physical appearance and growth of a fetus. By 10 weeks, the fetus is basically as the basic physical appearances of human. The limbs, which are made up of cartilage, have begun to form, and so has the body structure, right down to the eyelids and ears. Between 11 and 15 weeks, the fetus is approximately 5.4 centimetres long, and from 12 weeks the skeleton develops more and hardens a little more. The heartbeat can also now be monitored by ultrasound, and by 13 weeks the ovaries and testes have developed internally. From 15 weeks, the fetus has begun to develop a layer of hair called langugo around its body. 16 to 20 weeks. Now around 11.6 centimetres long and will reach 25.6 by 20 weeks. At 17 weeks, fingernails have begun to grow, as well as its own unique fingerprints. By 20 weeks, the fetus is covered in a white film called vernix. This protects its skin and assists the fetus movement during labour. It also helps the skin from drying out when the amniotic fluid has gone. 21 to 25 weeks, the fetus will grow from 26.7 centimetres to roughly 34.6 centimetres. The fetus will also grow more hair, including the eyebrows. This is also the point when the limbs on the body become more proportionate. From 26 to 40 weeks, the fetus has now made all its physical appearances of a baby. Instead, now it will just continue to grow in length and fill out more, ready for birth. The physiological development of a fetus. the organ growth within a fetus. The heart, from 6 weeks, the first movements of the heart can be seen in the embryo. At this point, it will beat at 110 beats per minute. The heart formed from 2 tubes. These combine and start to flow blood throughout the body. In the next 1 to 2 weeks, the chambers start to form, as well as the aorta, the atria and the vesicles. At 9 weeks, the aorta and the pulmonary arteries develop, and by 10 weeks, the heart is controlled by the embryo's brain. By 25 weeks, the capillaries start developing, and in the brain. At first, the embryo makes a neural plate, which is the base for the nervous system, and will also form a neural tube. This tube, over time, will constrict and develop into 3 areas of the fetal brain: the fore, mid and hind brain. These parts then divide and then form over each other, over and over, to form different parts of the brain. At this point, millions of neurons will form, and they will connect the brain to its different controls and functions over the body. When the fetus reaches the 2nd trimester, the fetus can control its diaphragm and chest, even swallowing. From 16 weeks, flutters can be felt from the womb, from limb movement, and in the 3rd trimester, the cerebrum start to form, and this gives the fetus more movement and advanced motor skills. The bone growth. The first months are the main parts of the skeleton are formed. However, the bones are still made up of cartilage. This is to keep the baby safe during delivery. The bones will start to harden after birth until the late teens. After the skeleton is formed, it just grows with the fetus. The sensory growth of the fetus. Touch. This typically begins in the face and starts from around 8 weeks and continues throughout pregnancy. The sight. The eyes start to develop from 8 weeks. However, the fetus has until 16 weeks before it can recognise the difference between light and dark within the womb. Sound. The ears are formed by 15 weeks until 25 weeks. This is when sounds start to become clearer for the fetus, and some respond to different sounds within the womb. For example, a person's voice or a loud bang. The smell and taste. Develop from around 6 weeks. This is when the palate and tongue start to form, and at 7 weeks the fetus grows taste receptors or buds. The smell starts to develop from 24 weeks, and it is believed that the fetus can smell and taste the amniotic fluid. Different ways in monitoring a fetus during pregnancy. Ultrasound. An ultrasound is one of the ways in which midwives and doctors can monitor the fetus within the womb. It is a scan that uses sound waves to see internally, like the organs and bones. In pregnancy, it enables midwives to see the fetus organs, its bones, the placenta, and everything within the uterus. This is all done without the need for surgery. The scans are given during pregnancy, and it will bring up any abnormalities that may not be seen from the outside of the body. An ultrasound can also tell the size of the fetus, show the fetus heart rate, where the fetus is within the womb, can see how many fetuses, will show how many weeks by the development of the fetus. In England, pregnant women are offered at least 2 scans. The first will be between 11 and 14 weeks, and this is just to determine the due date of the baby. The second is between 18 and 21 weeks, and this is a more in-depth and looks at the heart, brain, spinal cord, fluid around the fetus, development, and in some cases the sex. These scans are optional but can be refused, but are advised. There are 2 types of ultrasound. External, where a probe is run along the skin of the abdomen. Sound waves are made in this device and bounce off the fetus inside, including its organs and bones, sent to a computer and generates a picture of what is inside the womb. The pictures are made in real time and show different areas as the transducer is moved. And internal, uses the same processes as external, except the transducer is inserted into the vagina. This is not given as a routine, but may be offered for a more detailed image of the fetus. It is also used to find ectopic pregnancy. Another way to monitor baby during pregnancy is the Doppler. This is a small portable ultrasound machine which is, instead of pictures, monitors the fetal heart rate. Some midwives will use a piniard stethoscope, which is a trumpet-shaped instrument which they place on the abdomen to listen to the fetus heartbeat. Measuring the fundal height during pregnancy. The fundal height is the measurement that goes from the pubic bone to the top of the uterus. This is used to help midwives to see how baby is developing and its gestational age. The midwife will do this by having a pregnant woman lay down. They will take a tape measure and place it at the top of the uterus and pull the end down to the pubic bone. The measurement will be taken and plotted on a chart to see how the fetus is progressing. This is normally done from 20 weeks. Fetal monitoring during labour. Fetal monitoring, the monitoring of the fetus and the mother is very important during labour. It keeps them both safe and helps midwife to know of any distress or changes during labour. The pregnant person will be monitored during labour on the following: her temperature, heart rate and blood pressure, how often they urinate, contractions and cervical dilation. It is standard labour. During the first stage of labour, the fetus should be monitored every 15 minutes approximately, and the second stage of labour, the fetus will be monitored after contractions. Intermittent oscillation. This means a midwife will check the fetal's heartbeat using a specific machine, i.e. a Doppler. It is normally for standard straightforward pregnancy. Continuous cardiotocography or CTG. This is used when risk factors have been found during pregnancy. Some of these risks include early labour, health complications, including diabetes and infections, or if previous birth was a C-section. CTG covers 4 areas: electronic fetal monitoring, telemetry, fetal scalp electrode, and intrauterine catheter. 1. Electronical fetal monitoring. This is when an ultrasound device that monitors the heartbeat of the fetus through a transducer, which is placed on the abdomen. This is strapped down by belts. The monitor will make charts showing the fetal heartbeat, any contractions had, and it will also show multiple heartbeats if there are multiple fetuses. 2. Telemetry. This is when a pregnant woman is hooked up to a CTG monitor. This monitors fetal heartbeat, contractions, woman's temperature, as well as woman's blood pressure. 3. A fetal scalp electrode. This is when a small probe is attached to the scalp of the fetus during labour. This is so midwives can monitor the heart rate and health continuously. 4. The intrauterine pressure catheter. This is used to see how contractions are progressing. The catheter is inserted into the uterus and sits between the uterus and the fetus and the uterine wall. This is not a routine procedure and will only be used when clarity of contractions cannot be found any other way. How monitoring leads to intervention and change into birth plans. Birth plans are made by pregnant women consisted of what they would like to happen for their labour and birth, their preferences on medications, techniques and how. There is no right or wrong birth plan and they are all unique. When midwives are monitoring the pregnant woman, birth plans may change depending on how the fetus is during labour. Some people may suggest that they may not be able to take certain pain relief, but then end up needing it. Some distress of the fetus may be found, so pregnant women who may want a water birth in the plan may need an emergency C-section. This will only ever be to protect the health of the fetus and the pregnant woman. Interventions can take place in many forms and for many different reasons. Premature labour, which is labour that starts before 37 weeks, can lead to interventions and changes to birth plans. Depending on how many weeks early, it could change dramatically. If the labour starts particularly early, interventions such as medications to stop contractions may be given, or if too late to stop contractions, medications may be given to strengthen the fetus's lung before delivery. Emergency C-section is another intervention and it will be given if there is fetal distress. The fetus changes position during labour, if the fetus is too big for the birth canal, or if contractions stop and do not progress. And finally, if there is dramatic change to the fetus heartbeat or the mother's blood pressure or temperature. Other ways of intervention come in form of instrumental assistance. This includes a ventouse suction, which is the attaching of a suction cup to the head of the fetus. Then on a contraction, a midwife or healthcare professional will pull the baby out. Forceps. This is the use of forceps will fit on either side of the fetus's head. Then once again on the contraction, the baby will be pulled out. Episiotomy is when a medical professional will make an incision between the vagina and the perineum to help get the fetus out. The interventions will only be given if there is underlying health conditions, the fetus changes position, too big for birth, or is distressed and exhausted. Sometimes, if an epidural has been given, intervention is needed. Screening processes during pregnancy. During pregnancy, your midwife will recommend that you have certain blood tests or screening tests. These screenings are to see if the fetus has any health conditions, disorders, or genetic conditions that could cause complications. These include Down syndrome, also known as trisomy 21. Trisomy 21 is caused by the fetus having one extra set of chromosomes. This can happen due to a change in sperm or egg when it's in the uterus. That comes with a higher risk of heart and digestive problems, some problems in sight and hearing, and learning difficulties. Approximately 1 in 1,000 births is born with Downs. There are 3 types of Down syndrome. All have additional chromosome 18. Translocation is called because the additional chromosome 21 attaches to other chromosomes within the cell. Mosaic is when some cells form within a chromosome and some do not. Edwards syndrome, trisomy 18, is called from an additional copy of chromosome 18, so there are 3. This affects the development in the uterus, and this syndrome is also specified as life-limiting and comes with many health conditions. There is currently no cure, and approximately 1 in 1,500 births have it. There are 3 types. Full, which is a severe form of the syndrome where every cell has a 3rd chromosome 18. Most fetuses do not survive full term. Mosaic, where only some cells have the 3rd chromosome and the chances of survival from birth to 1 year are higher. And partial, which is the rarest type, where only a small number of cells are affected, means that it depends what cells are affected to what complications may occur. Patau syndrome, trisomy 13, caused by an additional chromosome 13. This causes devastating effects on development and can unfortunately result in miscarriage, which is 70% likely. It is very rare for children with this syndrome to live past their 1st birthday. The syndrome causes changes to appearance, including cleft palate, smaller eyes, smaller head circumference, sometimes loss of one eye or both, additional fingers and toes, and malformations of the ears. There are also 3 types. Screening tests are done for these 3 syndromes, can take place between 10 and 14 weeks of pregnancy. It is called the combined test. The pregnant woman has the choice to screen or not, and what syndromes they wish to screen for. The test involves an ultrasound and a blood test. The ultrasound is used to measure an area at the back of the leg for fluid and additional fluid. There could be a genetic or physical condition. The blood test can also tell if there's extra chromosomal activity. If further tests are offered, the following will happen. For Down syndrome, a second test will be offered from 14 to 20 weeks. This next test will see the likelihood of Downs by looking at 4 things in the woman's blood. The alpha fetoprotein, inhibin S, beta human chorionic gonadotrophin, and unjugulated esterol. Edwards and Patau syndrome, the second screening is offered and is optional as it involves a 1 in 200 chance of miscarriage. There are 2 tests, the chorionic villus sampling, which is when a needle is used to take a sample of the placenta, an ultrasound is used, and the amniocensis is a needle which is used to take a sample of amniotic fluid, and an ultrasound is also used. Other testing or screening available is sickle cell. This is a serious condition which affects the person's blood flow and is offered as a blood test from 10 weeks. It is optional and both parents can be tested for any genetic markings for sickle cell anemia. If both are found to be carriers, then a diagnostic test will be offered, the same as the Edwards syndrome. Fetal anemia. This is where the blood of the fetus and the pregnant woman are not compatible and can cause heart problems and birth difficulties if not treated. Normally it's picked up on an ultrasound. Isoimmunization, aka rhesus disease. Means that the fetus's immune system doesn't identify its blood and instead attacks it. It can be treated easily with injections of anti-D immunoglobulin. The risks of miscarriage, including dispelling myths. Miscarriage means the loss of pregnancy and refers to this happening within the first 12 weeks of pregnancy. Unfortunately, 1 in 5 pregnancies end in miscarriage before 12 weeks. There are many reasons of why miscarriage may occur, but sometimes it's not possible to determine. Especially before 12 weeks, it is very hard to find out why, but it sometimes happens because of chromosome defects or development problems within the fetus. Some known links to miscarriage include age over 30, carrying a 20% risk, over 40s carrying a 50% risk. Medical conditions, lifestyle choices, including drugs, smoking, and weight issues. There has been no proof that having intercourse during pregnancy causes miscarriage within the first 12 weeks. Although miscarriage after 12 weeks is much less common, it can happen for a range of reasons, including infections and problems with the placenta or cervix. Ways to reduce your chances of miscarriage. There are ways in which you can reduce your chances of miscarriage, including stopping smoking, reducing or cutting out alcohol, only drinking the recommended levels of caffeine, stopping taking recreational drugs. If you are overweight, it is recommended you try to lose some. Myths on miscarriage that have been proven not to be true are going to the gym, heavy lifting, stressful days at work, and if you have any concerns about miscarriage, always consult your midwife. Types of miscarriage. There are 3 types of miscarriage. A missed miscarriage, this is when the embryo stops growing but stays in the womb. There isn't normally any signs and is found on the ultrasound. A complete miscarriage. This is when all of the pregnancy is removed by the body. And a molar miscarriage is rare. This is when a fetus doesn't develop properly due to the fertilizing of an egg with no genetic information for the pregnant person. There is also ectopic pregnancy. This is when the pregnancy is not in the uterus. This is potentially severe to the pregnant person and unsustainable for the fetus. 1 in 80 pregnancies are ectopic and need to be found so they can be removed. For some reasons for ectopic pregnancy are endometriosis, fertility issues, previous ectopics, being over the age of 35 and issues with fallopian tubes. Medical or surgical intervention. A pregnant person. If a person suffers from bleeding, pain or unusual feelings, please seek medical advice. If you are further than 20 weeks, reduced movements could always be checked by a midwife. If the pregnant woman has been assessed by a midwife and doctor and a miscarriage is happening, the following interventions will take place. An expectant. This is when they let the body expel the pregnancy on its own. Medical is when they'll give the pregnant woman medication to help pass the pregnancy. And surgical. This is when surgery is used to help remove the whole pregnancy. Some people who have a miscarriage will be given the option to have a burial, cremation, or memorial for their past pregnancy. This can be done at home or by some medical practices. This is optional. At this hard and tragic time, support will be offered for pregnant woman and her partner. There are many support groups and helplines. The process of medical and surgical termination. Under UK law, a termination must be done if required before 24 weeks. If it's needed after 24 weeks, it must be because the pregnant woman's life is in danger. The pregnant person is at risk of harm or a severe abnormality has been found with the fetus. There are two forms of termination, surgical or medical. The woman will be assessed to see which one they need, and this includes a psychological test. Some other tests, like STI, ultrasound, and blood, will be taken. The person will be told which procedure is available depending on the test results. They will also talk about protection for afterwards and how they are feeling. A medical termination. This is called a medical termination because it is in the form of medication that you can take orally. It is recommended that the pregnant person comes in as early as possible and is available up to 16 to 18 weeks. However, after 11 weeks you can still take the tablets, but you have to do so in hospital. The tablets work by making the lining of your uterus and the embryo come away, a little like a period with just some varying amounts of pain. If before 12 weeks, you can normally take the medications and pass at home. Surgical termination, called as such because it is required to do so in a licensed hospital. There are two types. Vacuum aspiration, this is where a small tube is put in the vagina towards the cervix and removes the pregnancy. It is offered up until 13 to 14 weeks and only takes 10 minutes. The second is dilation and evacuation. This involves inserting forceps into the cervix towards the womb and removing the pregnancy. This is offered after 14 weeks and lasts 20 minutes. In termination after 20 weeks, an operation will be performed after the pregnant woman has been given an injection which will stop the fetus's heart. This can be done under general anaesthetic. Like any procedure, there are risks that come with termination. Surgical terminations involve severe bleeding, damage to womb, sepsis, and sometimes another procedure to remove the pregnancy. Medication termination, severe bleeding, womb damage, sepsis, and another procedure. In conclusion, being pregnant is an amazing time for most women. The changes from egg to embryo, fetus, and then to fetus are phenomenal. The ways of monitoring the fetus are life-changing for both pregnant women and fetus, and are often vital. Screening processes have been investigated, including the reasons why and how important they are. We have looked at the devastating risks of miscarriage and dispelled the myths around them.